You might be taking something right now that's supposed to help you, but it could be silently damaging your brain. Today, we're exposing 5 surprising remedies that could increase your risk of dementia. Stay till the end. Number 5 is shocking. Welcome to Golden Health Journey, where we uncover the truth about your health in simple, science-backed ways. If you care about your brain, hit the like button and subscribe. Let's dive in. First, we have statins. Statins are widely prescribed medications used to lower cholesterol levels and reduce the risk of heart disease. While they are effective at managing blood lipid profiles, emerging research has raised concerns about their potential side effects, particularly their connection to cognitive decline in dementia. Many patients taking statins report experiencing memory loss, confusion, and other mental fog symptoms. This has led scientists to investigate how these drugs might affect brain health over time. One of the main mechanisms by which statins may contribute to dementia lies in their impact on cholesterol. Cholesterol is essential for brain function, especially in the formation and maintenance of synapses, the connections between neurons. The brain contains about 25% of the body's total cholesterol, and it plays a crucial role in the communication between brain cells. By aggressively lowering cholesterol, statins may disrupt these processes and impair cognitive performance. Statins work by inhibiting an enzyme called HMG-CoA reductase, which is involved in cholesterol production in the liver. However, this enzyme is also linked to the production of coenzyme Q10, CoQ10, a compound vital for energy production in cells, including brain cells. When CoQ10 levels drop, mitochondrial function can be compromised, leading to oxidative stress and neuronal damage, both of which are known contributors to dementia. Moreover, statins can cross the blood-brain barrier, especially the lipophilic types like simvastatin and atorvastatin. Once in the brain, these drugs may interfere with the synthesis of essential compounds required for proper brain signaling. Disruptions in neurotransmitter systems can lead to symptoms commonly associated with dementia, such as memory lapses, slowed thinking, and mood changes. Another concern is inflammation. While statins are known to reduce systemic inflammation, there's growing evidence suggesting they may trigger neuroinflammation in certain individuals. This inflammatory response in the brain can accelerate the degeneration of neurons and has been associated with various neurodegenerative conditions, including Alzheimer's disease. Cognitive side effects of statins may also stem from their effect on lipid rafts, cholesterol-rich areas of the cell membrane that are essential for cellular communication. These rafts play a role in signal transduction and receptor activity. When statins alter the cholesterol content in these rafts, it can impair the function of neurons and contribute to brain dysfunction. Several observational studies have noted a link between statin use and increased risk of dementia. Although not all research agrees, and some even suggest protective effects, the inconsistency highlights the complexity of how statins interact with the brain. Factors like age, dosage, type of statin, and individual sensitivity may all influence whether a person experiences cognitive side effects. In some cases, patients who stop taking statins report improvement in their mental clarity and memory, further suggesting a connection. These anecdotal experiences have prompted healthcare providers to monitor cognitive function more closely in patients on long-term statin therapy, especially among older adults. Genetic factors may also play a role in how statins affect the brain. For example, individuals with the F4 gene variant, a known risk factor for Alzheimer's, might be more vulnerable to the cognitive side effects of statins. This makes personalized medicine an important consideration in prescribing these drugs. It's important to note that not everyone taking statins will experience cognitive decline. However, the possibility that these drugs could contribute to dementia means that risks and benefits must be carefully weighed. This is especially critical for individuals who have no history of heart disease and are prescribed statins primarily for prevention. Doctors and researchers continue to study the long-term effects of statins on brain health. More clinical trials are needed to fully understand the relationship and identify which populations are most at risk. Until then, informed decision-making and regular cognitive assessments are essential for those on statin therapy. Next, we have sleep aids. Sleep aids are commonly used to help people fall asleep faster, stay asleep longer, and manage insomnia. These medications, which include both prescription drugs like benzodiazepines and over-the-counter options like antihistamines, are often considered a quick fix for poor sleep. However, growing evidence suggests that long-term use of sleep aids may carry serious risks, including an increased likelihood of developing dementia. One of the primary concerns with sleep aids is their impact on brain chemistry. Many of these drugs work by enhancing the effects of gamma-aminobutyric acid, GABA, a neurotransmitter that slows brain activity and promotes relaxation. While this mechanism can be effective for sleep in the short term, excessive or prolonged GABA stimulation can dull brain function and impair memory formation over time. Benzodiazepines such as diazepam and lorazepam are especially problematic. They not only promote sedation, but also interfere with the brain's ability to consolidate memories. Studies have shown that regular use of benzodiazepines is associated with a higher risk of Alzheimer's disease and other forms of dementia, particularly when used for more than 3 to 6 months. Over-the-counter sleep aids often contain diphenhydramine or doxylamine, which are first-generation antihistamines with strong anticholinergic properties. These compounds block acetylcholine, a neurotransmitter essential for learning and memory. Chronic disruption of acetylcholine pathways has been strongly linked to cognitive decline and is a hallmark of Alzheimer's pathology. The brain relies on deep sleep, especially slow-wave sleep and REM sleep, to perform critical functions such as memory consolidation, toxin clearance, and emotional regulation. Many sleep aids alter the natural sleep architecture by reducing the amount of deep restorative sleep, leaving the brain less able to perform these essential tasks. Over time, this poor quality sleep may contribute to neurodegeneration. Another issue is the buildup of beta-amyloid plaques, a key feature of Alzheimer's disease. Proper sleep helps clear these toxic proteins from the brain. However, reliance on sedatives can lead to fragmented or shallow sleep that may hinder this clearance process. This allows harmful substances to accumulate and damage neurons. Sleep aids can also impair attention, problem-solving, and reaction time, even after the drug has worn off. This lingering cognitive dullness, often referred to as a hangover effect, can become more pronounced with long-term use. These subtle cognitive impairments may progress into more serious memory problems over time. Elderly individuals are particularly vulnerable to the cognitive side effects of sleep aids. Age-related changes in drug metabolism can cause these substances to stay in the body longer, increasing their sedative and neurotoxic effects. Seniors who regularly take sleep medications have shown higher rates of confusion, disorientation, and eventually dementia diagnoses. Another overlooked factor is drug dependency. Many sleep aids can lead to tolerance, meaning higher doses are needed over time to achieve the same effect. This escalating use increases exposure to the very substances that may damage brain health. Withdrawal symptoms, which include anxiety, insomnia, and cognitive disturbance, can further complicate the picture. Some sleep aids are combined with other medications, such as pain relievers or anti-anxiety drugs, which may compound their effects on the brain. Polypharmacy increases the risk of adverse drug interactions, many of which are known to impact cognition. This is especially concerning for older adults who may already be taking multiple medications. There is also growing concern about melatonin supplements. Although generally considered safe, high or inconsistent dosages of melatonin may disrupt the natural sleep-wake cycle, especially if taken improperly. Long-term misuse can interfere with the body's internal clock and reduce the brain's natural ability to regulate sleep, indirectly affecting cognitive performance. Next, we have proton pump inhibitors. Proton pump inhibitors, commonly known as PPIs, are among the most frequently prescribed medications worldwide. They are primarily used to treat conditions like acid reflux, GERD, and stomach ulcers by reducing the amount of acid the stomach produces. Drugs such as omeprazole, esomeprazole, and lansoprazole fall into this category. While they are effective in controlling stomach acid and relieving discomfort, emerging research has raised concerns about the long-term effects of PPIs on brain health, particularly their potential link to dementia. One of the key mechanisms by which PPIs might contribute to dementia is through their effect on nutrient absorption. Stomach acid plays a crucial role in breaking down food and absorbing essential vitamins and minerals. PPIs significantly reduce stomach acid, which can lead to deficiencies in nutrients like vitamin B12, magnesium, and calcium. Among these, vitamin B12 is especially important for brain function. A deficiency in B12 can cause symptoms such as memory loss, confusion, and cognitive impairment, all of which mimic or contribute to dementia. Another issue involves the gut-brain connection. The gastrointestinal system and the brain are deeply interconnected through what is known as the gut-brain axis. The reduction in stomach acid caused by PPIs can alter the composition of gut microbiota, leading to an imbalance known as dysbiosis. Healthy gut bacteria play a role in regulating inflammation, producing neurotransmitters, and maintaining cognitive function. When this balance is disrupted, it may lead to increased inflammation and contribute to neurodegeneration, which is a hallmark of dementia. PPIs have also been shown to cross the blood-brain barrier, which is the protective shield that separates the brain from harmful substances in the bloodstream. Once inside the brain, PPIs may interfere with the clearance of beta-amyloid proteins, which are closely linked to the development of Alzheimer's disease. Studies suggest that impaired removal of these proteins can result in their accumulation, leading to plaque formation that damages neurons and disrupts memory and cognitive abilities. Chronic use of PPIs has been associated with reduced nitric oxide production, which is essential for maintaining healthy blood vessels and proper circulation in the brain. Poor blood flow can deprive brain cells of oxygen and nutrients, increasing the risk of cognitive decline. Over time, this can contribute to the kind of vascular damage that is often seen in patients with dementia. Inflammation is another pathway through which PPIs may influence brain health. By altering gut bacteria and impairing nutrient absorption, PPIs can trigger systemic inflammation. Inflammation has long been linked to a higher risk of dementia, as it can damage brain cells and promote the progression of neurodegenerative diseases. Chronic inflammation can disrupt communication between neurons and accelerate brain aging. There is also growing concern about the oxidative stress caused by long-term PPI use. Oxidative stress results from an imbalance between free radicals and antioxidants in the body. When PPIs deplete important antioxidants such as magnesium and B12, they may leave the brain more vulnerable to oxidative damage. This can impair cellular function in the brain and contribute to the slow degeneration of cognitive ability over time. Elderly patients are particularly at risk when it comes to the cognitive side effects of PPIs. As the body ages, it becomes less efficient at processing and eliminating drugs. This means that PPIs can stay in the system longer and exert stronger effects. Additionally, older adults are more likely to already have compromised nutrient levels, weaker gut health, and age-related cognitive decline, all of which can be worsened by PPI use. Observational studies have found a notable association between long-term PPI use and increased incidence of dementia. While these studies do not prove causation, they do highlight a pattern that warrants caution. Patients who take PPIs for extended periods, especially those over the age of 65, show higher rates of memory loss and other cognitive impairments compared to those who do not use these medications. Another concern is that PPIs are often used excessively or inappropriately. Many people take them without a clear diagnosis or continue using them for years without medical supervision. This widespread overuse increases the likelihood of long-term side effects, including those that affect the brain. Healthcare providers are now being urged to reevaluate the need for PPI prescriptions and encourage alternative treatments when appropriate. Although PPIs are beneficial for managing stomach acid-related conditions, the potential cognitive risks highlight the importance of using them responsibly. Patients should have their nutrient levels monitored regularly, especially if they are on long-term PPI therapy. Supplementation with B12 and magnesium may help offset some of the negative effects, but these strategies should be discussed with a healthcare provider. In light of these findings, lifestyle changes such as dietary adjustments, stress management, and weight control should be considered as first-line options for treating acid reflux before resorting to PPIs. These non-drug approaches not only improve digestive health but also eliminate the risk of side effects that may affect the brain. For those who do need PPIs, the goal should be the lowest effective dose for the shortest possible time, always under medical guidance. Next, we have benzodiazepines. Benzodiazepines are a class of drugs commonly prescribed for anxiety, insomnia, seizures, and muscle spasms. They include medications like diazepam, Valium, lorazepam, Ativan, alprazolam, Xanax, and clonazepam, Klonopin. These drugs work by enhancing the effect of a neurotransmitter called gamma-aminobutyric acid, or GABA, which has a calming effect on the brain. While this makes benzodiazepines highly effective for short-term relief of anxiety and sleep disorders, long-term use has been increasingly linked to cognitive decline and a heightened risk of dementia. One of the main concerns with benzodiazepines is how they affect memory and learning. These drugs suppress activity in the central nervous system, including areas of the brain responsible for memory formation, such as the hippocampus. When these regions are repeatedly subdued, the brain's ability to encode new memories weakens. Over time, this can lead to memory loss that extends beyond the period of drug use, potentially contributing to long-term cognitive impairment. Another issue is the way benzodiazepines alter the brain's natural sleep architecture. While they may help users fall asleep more quickly, they also reduce the time spent in deep sleep and REM sleep, both of which are crucial for memory consolidation and brain restoration. Without enough restorative sleep, the brain becomes less efficient at clearing out waste proteins like beta amyloid, which are associated with the development of Alzheimer's disease. Long-term benzodiazepine use has also been shown to decrease brain plasticity, the ability of the brain to adapt, learn, and recover from damage. Reduced neuroplasticity makes the brain more vulnerable to aging and degenerative conditions. In elderly populations, this effect is especially troubling, as aging brains are already experiencing a natural decline in plasticity, making them more susceptible to the negative effects of these medications. Another mechanism by which benzodiazepines may contribute to dementia is through their impact on neurotransmitter balance. These drugs primarily enhance GABA, but do so at the expense of other important neurotransmitters such as acetylcholine, which is essential for attention, learning, and memory. Acetylcholine deficiency is a well-documented characteristic of Alzheimer's disease, and benzodiazepines may exacerbate this imbalance, especially when used over long periods. Numerous observational studies have found a significant association between benzodiazepine use and an increased risk of dementia. One study published in the BMJ found that people who had used benzodiazepines for 3 to 6 months had a 32% higher risk of developing Alzheimer's, and those who had used them for more than 6 months had an 84% increased risk. Although these studies do not prove direct causation, the consistency of the findings across multiple investigations is cause for concern. Older adults are particularly vulnerable to the cognitive side effects of benzodiazepines. With age, the body's ability to metabolize drugs slows down, meaning that these medications can stay in the system longer and exert more prolonged effects. This can lead to confusion, drowsiness, and episodes of delirium that may be mistaken for early dementia, or worse, may evolve into chronic cognitive issues over time. In addition to direct neurological effects, benzodiazepines increase the risk of falls, head injuries, and accidents, especially in older users. Falls and head trauma can result in brain damage that compounds the cognitive decline already triggered by the drug. These secondary effects often go unnoticed, but can significantly accelerate the progression toward dementia. Withdrawal from benzodiazepines also presents risks to cognitive health. When the medication is stopped after prolonged use, users often experience withdrawal symptoms such as anxiety, insomnia, irritability, and difficulty concentrating. These symptoms can last for weeks or even months, and during this period, the brain may struggle to regain its normal chemical balance, potentially leading to lasting cognitive disruption. The danger is compounded by the fact that benzodiazepines are often prescribed in combination with other central nervous system depressants like opioids or alcohol. These combinations can have synergistic effects, dramatically increasing the risk of cognitive decline, sedation, and overdose. Polypharmacy is especially problematic in elderly patients, who are often prescribed multiple medications for different conditions. Dependence on benzodiazepines is another factor that can lead to cognitive deterioration. Many users develop a tolerance to the drugs and require higher doses to achieve the same effect, increasing their exposure to the cognitive risks. Psychological dependence may also prevent individuals from exploring non-pharmacological treatments for anxiety and insomnia, such as cognitive behavioral therapy, mindfulness, or lifestyle changes that are safer and often more effective in the long term. In conclusion, while benzodiazepines can offer short-term relief for anxiety and sleep disorders, their long-term use is fraught with risks, particularly for cognitive health. The suppression of memory formation, disruption of sleep cycles, reduction in brain plasticity, and interference with essential neurotransmitters create a perfect storm that can accelerate the onset of dementia. For these reasons, healthcare providers and patients alike should exercise caution and prioritize alternative treatments whenever possible, especially for older adults and those with a family history of cognitive disorders. Last, we have anticholinergic medications. Anticholinergic medications are a broad class of drugs used to treat a variety of conditions including allergies, depression, Parkinson's disease, asthma, overactive bladder, and even some gastrointestinal disorders. These medications work by blocking acetylcholine, a neurotransmitter that plays a crucial role in transmitting messages in the nervous system. While effective in managing symptoms, research has increasingly shown that long-term use of anticholinergic drugs can have serious consequences on brain health, particularly increasing the risk of developing dementia. One of the most concerning effects of anticholinergic drugs is their interference with acetylcholine, which is essential for memory, learning, attention, and overall cognitive function. Acetylcholine is one of the main neurotransmitters that supports communication between nerve cells in the brain. When this system is disrupted over time, especially in older adults, it can impair thinking, slow down processing speed, and eventually contribute to neurodegenerative disorders like Alzheimer's disease. Essentially, the very mechanism that helps these drugs relieve physical symptoms may also slowly erode cognitive capacity. The cumulative anticholinergic burden plays a key role in the development of dementia. This refers to the overall effect of multiple medications that block acetylcholine, even if each individual drug only has a mild anticholinergic effect. Many patients, especially seniors, take several medications daily, some of which have hidden anticholinergic properties. Over time, this accumulation places enormous strain on the brain's ability to function normally, leading to memory problems, confusion, and ultimately, long-term cognitive decline. Studies have found that prolonged exposure to anticholinergic drugs is associated with an increased risk of dementia. One notable study published in JAMA Internal Medicine found that people who took strong anticholinergic medications daily for 3 years or more had a significantly higher risk of developing dementia compared to those who did not use them. Importantly, the risk did not go away even after the medications were discontinued, suggesting that the damage may be long-lasting or even permanent in some cases. Older adults are especially vulnerable to the effects of anticholinergic medications. As the brain ages, its ability to compensate for chemical disruptions diminishes. This makes older individuals more susceptible to the cognitive side effects of these drugs. Moreover, age-related changes in the blood-brain barrier may allow more of the drug to enter the brain, increasing its impact. What may be a mild side effect in a younger person could become a significant cognitive problem in someone over the age of 65. The effects of anticholinergic drugs often begin subtly. Users might first notice minor memory lapses, trouble focusing, or a general sense of mental fog. These early signs can easily be mistaken for natural aging or stress. However, as the use of the medication continues, the symptoms may progress to more noticeable cognitive decline, affecting daily functioning and independence. In many cases, these changes are not recognized as drug-related, and the medications continue to be prescribed. Another issue is that many commonly used over-the-counter drugs also have anticholinergic properties. Medications for allergies like diphenhydramine, Benadryl, sleep aids, cold remedies, and even some anti-nausea drugs contain ingredients that block acetylcholine. Because these drugs are so easily accessible, people often use them frequently and without realizing the potential long-term impact on their brain health. This widespread and casual use adds to the growing concern over how prevalent anticholinergic exposure has become. Beyond memory and cognition, anticholinergic drugs can also affect mood and emotional regulation. Patients on long-term regimens sometimes report symptoms of depression, anxiety, or irritability. These emotional changes further impact quality of life and can make dementia symptoms more difficult to manage if they do arise. As the brain struggles to maintain its neurotransmitter balance, the emotional system becomes destabilized, leading to additional mental health challenges. The structural changes in the brain associated with anticholinergic use are alarming. Imaging studies have revealed that long-term users may experience reduced brain volume in key areas responsible for memory and learning. These changes resemble those seen in patients with Alzheimer's disease, reinforcing the idea that anticholinergic drugs are not merely causing temporary confusion, but may actually be contributing to lasting physical changes in the brain. Withdrawal from anticholinergic medications doesn't always lead to full recovery. In some cases, cognitive function does improve after stopping the drug, but in others, the damage appears to persist. This has led researchers to conclude that early detection and discontinuation of these medications is crucial. The longer the brain is exposed to the effects of acetylcholine-blocking drugs, the less likely it is to fully recover its cognitive abilities. Healthcare providers are increasingly urged to assess the anticholinergic burden in their patients, especially the elderly. Tools and rating scales now exist to measure the cumulative effects of these drugs. Doctors are encouraged to seek safer alternatives whenever possible and to educate patients about the risks. For conditions like insomnia, allergies, or mild depression, non-anticholinergic treatments or lifestyle changes may offer similar relief without the cognitive risk.